Are you over 50 and struggling with high blood pressure? What if I told you that simple spices in your kitchen could help you manage it naturally? Stay tuned, because today, as a doctor with years of research experience, I am sharing 5 powerful spices that can lower your blood pressure and improve your heart health. Let us dive in. Why high blood pressure matters for older adults. High blood pressure, or hypertension, is a silent threat that affects millions of older adults. It increases the risk of heart attacks, strokes, and kidney problems. As we age, our blood vessels lose flexibility, making it harder for the heart to pump blood effectively. Many of you may be taking medications, but did you know that certain spices can complement your treatment and support healthier blood pressure levels? By the end of this video, you will know exactly which spices to use, how they work, and how to add them to your daily routine. Let us address this problem with practical, science-backed solutions. Understanding blood pressure and spices. Before we explore the spices, let us clarify what high blood pressure means. Blood pressure measures the force of blood against your artery walls. A reading above 130/80ths of a millimeter of mercury is considered high for older adults. According to the American Heart Association, left unmanaged, it strains the heart and damages blood vessels. Spices, rich in antioxidants and bioactive compounds, can help relax blood vessels, reduce inflammation, and improve circulation. These natural remedies are not a replacement for medication but can enhance your efforts to maintain healthy blood pressure. Now, let us explore the 5 spices that can make a difference. Spice 1. Turmeric. First up is turmeric, a golden spice known for its active compound, curcumin. Curcumin has powerful anti-inflammatory and antioxidant properties that can benefit your heart. Inflammation in blood vessels can cause them to stiffen, raising blood pressure. Research shows that curcumin helps reduce inflammation and oxidative stress, which are key contributors to hypertension. A 2019 study published in the journal Nutrients found that curcumin supplementation improved blood vessel function in older adults, leading to lower blood pressure readings over 12 weeks. Another study in the American Journal of Hypertension reported that curcumin enhances nitric oxide production, which helps blood vessels relax and improves blood flow. How to use turmeric. Add 1 teaspoon of ground turmeric to your smoothies, soups, or stir-fries daily. For better absorption, pair it with a pinch of black pepper, which boosts curcumin's bioavailability by up to 2.000%. According to research in Planta Medica, you can also make a turmeric tea by simmering 1 teaspoon of turmeric in hot water with a dash of honey and lemon. Aim for 1 to 2 teaspoons daily. But start small if you are new to turmeric to avoid digestive discomfort. Notes: if you are on blood thinners like warfarin, consult your doctor, as turmeric may enhance their effects. Spice 2. Garlic. Next is garlic, a kitchen staple with remarkable cardiovascular benefits. Garlic contains allicin, a sulfur compound that promotes blood vessel relaxation and reduces blood pressure. It also helps lower cholesterol levels, which can further protect your heart. A 2016 meta-analysis in the Journal of Nutrition reviewed 20 clinical trials and found that garlic supplements significantly reduced systolic blood pressure by an average of 8.6 mm of mercury and diastolic by 6.1 mm of mercury in hypertensive patients. These reductions are comparable to some medications. Fresh garlic may offer similar benefits, as cooking can reduce allicin's potency. How to use garlic. Crush 1 to 2 fresh garlic cloves and let them sit for 10 minutes to maximize allicin release. Add them to salads, sauces, or roasted vegetables. If you prefer supplements, look for aged garlic extract, standardized to 1.2 mg of allicin, and follow the dosage instructions. Aim for 1 to 2 cloves daily or as advised by your doctor. Caution: garlic may interact with blood thinners or antiplatelet drugs, so check with your healthcare provider if you are on these medications. Spice 3. Cinnamon. Cinnamon is not just for desserts. It is a heart-healthy spice that can help lower blood pressure. Its active compounds, like cinnamaldehyde, improve blood vessel dilation and reduce insulin resistance, which is often linked to hypertension in older adults. A 2020 study in the journal Phytotherapy Research found that cinnamon supplementation, 1.5 grams daily, reduced systolic blood pressure by 5.4 mm of mercury in adults with type 2 diabetes and hypertension. Another study in the Journal of Clinical Nutrition reported that cinnamon improves endothelial function, which supports healthy blood flow. How to use cinnamon: sprinkle half a teaspoon of ground cinnamon on oatmeal, yogurt, or fruit smoothies. You can also add it to coffee or tea for warm, flavorful boost. Ceylon cinnamon, also called true cinnamon, is preferred over cassia cinnamon due to its lower coumarin content, which can be harmful in large amounts. Aim for half to 1 teaspoon daily. Caution: if you have liver issues or take medications metabolized by the liver, consult your doctor, as cinnamon may interact with certain drugs. Spice 4. Ginger. Ginger, with its zesty flavor, is another spice that supports healthy blood pressure. Its active compounds, like gingerol and shogal, have anti-inflammatory and vasodilatory effects, meaning they help widen blood vessels to improve blood flow. A 2017 study in the journal Nutrition found that ginger supplementation, 2 grams daily, reduced systolic blood pressure by 6.4 mm of mercury in adults with hypertension. Ginger also inhibits angiotensin-converting enzyme, ACE, similar to some blood pressure medications. According to research in phytomedicine. How to use ginger: grate 1 teaspoon of fresh ginger into stir-fries, soups, or smoothies. For a soothing ginger tea, steep 1 teaspoon of grated ginger in hot water for 10 minutes. Then add honey or lemon. If using ground ginger, use half a teaspoon, as it is more concentrated. Aim for 1 to 2 teaspoons of fresh ginger daily. Caution: ginger may enhance the effects of blood thinners or diabetes medications, so consult your doctor if you are on these treatments. Spice 5. Cayenne pepper. Last but not least is cayenne pepper, a fiery spice that can give your blood pressure a healthy boost. Its active compound, capsaicin, promotes blood vessel relaxation and improves circulation. Capsaicin also reduces sodium retention, which can contribute to high blood pressure. A 2018 study in the journal Bioscience Reports found that capsaicin supplementation lowered systolic blood pressure by 4.8 mm of mercury in adults with hypertension. Another study in Cell Metabolism showed that capsaicin activates TRPV1 receptors, which help regulate blood pressure. How to use cayenne pepper: start with a pinch, about 1/8 of a teaspoon, in soups, stews, or chili, as it is potent. Gradually increase to 1/4 teaspoon daily if you tolerate the heat. You can also mix a pinch into warm water with lemon for a morning detox drink. If you prefer capsules, follow the dosage instructions. typically 30 to 120 milligrams daily. Caution: avoid cayenne if you have acid reflux or stomach ulcers, as it may cause irritation. Consult your doctor if you are on blood pressure medications. Practical steps to incorporate these spices. Now that you know the 5 spices, turmeric, garlic, cinnamon, ginger, and cayenne pepper, let us talk about how to make them part of your daily life. Here are 5 actionable steps to get started. Step 1. Create a spice blend. Mix equal parts ground turmeric, cinnamon, and ginger, with a pinch of cayenne. Store it in an airtight container and sprinkle it on meals daily. Step 2. Start your day with a spice-infused drink. Try turmeric tea, ginger tea, or lemon water with a pinch of cayenne to kickstart your metabolism and support blood pressure. Step 3. Add fresh garlic to at least 1 meal daily. Crush it and let it sit to maximize its benefits. Then toss it into your favorite dishes. Step 4. Experiment with recipes. Try turmeric in soups, cinnamon in breakfast bowls, or ginger in stir-fries. Check out heart-healthy recipes on trusted sites like the American Heart Association's website. Step 5. Monitor your progress. Keep a blood pressure log to track your readings weekly. Share the results with your doctor to adjust your treatment plan if needed. These steps are simple, affordable, and backed by science. Consistency is key, so start small and build these habits over time. You might be wondering, are these spices safe for everyone? While generally safe in culinary amounts, they can interact with certain medications, like blood thinners, diabetes drugs, or antihypertensives. Always consult your doctor before adding these spices, especially if you have chronic conditions or take medications. Another concern is taste. If you are not used to spicy flavors, start with small amounts and pair them with familiar foods. For example, mix cinnamon into yogurt or turmeric into scrambled eggs to ease into the flavors. Finally, some of you may ask, can I rely on spices alone? No, spices are a complement to a healthy lifestyle. Pair them with a balanced diet, regular exercise, stress management, and proper medication if prescribed. The DASH diet, dietary approaches to stop hypertension, recommended by the National Heart, Lung, and Blood Institute, is a great framework to follow. High blood pressure does not have to control your life. By adding turmeric, garlic, cinnamon, ginger, and cayenne pepper to your diet, you can take proactive steps to support your heart health. These spices are affordable, accessible, and backed by research to help lower blood pressure naturally. Start with 1 spice this week. Try a new recipe, and share your experience in the comments below. Which spice are you most excited to try? If you found this video helpful, please give it a thumbs up. Subscribe to Health Secrets for more science-backed tips. And hit the bell icon so you never miss an update. Your health is worth it, and we are here to guide you every step of the way. Stay healthy, and we will see you in the next video.